The heart, el corazón, surrounded by a pericardium sac that's going to lubricate and protect the heart. Then, within the heart itself, there's a very thick muscular myocardium on the side. In the middle, there's a septum that separates the two chambers. And then, if you look closely, you'll see tiny chordae tendineae, and they're attached to valves. I'll talk about what they do. Here's a color version. If you look at the heart, there's a right atrium here. It's your patient's heart, right side. Here's the left atrium. So there's an atrium here and here. There's a ventricle below each atrium, 4 chambers. And here are the atrioventricular valves that separate the atrium from the ventricle. And these chordae tendineae are going to keep the flaps open during the cardiac cycle, which I'm going to talk about. Their job is to prevent backflow because we want blood moving in one direction. Take a look here at the cat's a nice example specimen because we can show it without anyone getting too upset. You can see the heart, and coming out of it are 2 important vessels. The blue one is going to be the pulmonary cycle. The red is the arterial cycle. Blue dye is often used to indicate a deoxygenated blood flow. All right, and semilunars. Semilunars are up here where the blood is leaving the heart, either through the pulmonary circuit or through the aorta. We have 2 contractions of the heart. Really, there's the systole is the main contraction phase, where we have the ventricles on either side forcing blood either through the pulmonary cycle, which is here, here to the lungs, or here to the body. The diastole is when we have ventricles relaxing. In the cardiac cycle, look at A to your left. Atria are going to contract, forcing blood into the ventricles. From here, the AV, atrioventricular valve, is going to snap shut to prevent backflow. And then B, the ventricle is going to contract, and here it is. As they contract, they're going to force blood either through the body, through the circulatory system there, or through the pulmonary circuit to the lungs. The semilunars, I mentioned those are the ones leaving the ventricles on either side, semilunar. The aortic is the one going to the aorta, and the pulmonary semilunar here. Cardiac output, the amount of blood each ventricle pumps per minute. If we look at cardiac tissue under the microscope, we'll see these ventriculated discs. They're very faint junctions so that cardiac muscle is interconnected. Thus, we have this powerful contraction that so strong the heart quivers. And so there's no sloppiness like on a skeletal muscle. Flexing your bicep is nowhere near as precise and fast as the heart. Cardiac conduction system, kind of cool. The heart has its own cardiac pacemaker. That's why you may be seeing karate movies. The guy pulls the heart out of his victim and it's still pumping. Well, you know, some of that's true because this SA node here, who sends out this electrical impulse, the AV picks it up. I always think of it opposite of alphabetical, S before A, and the AV is going to have a role as well, and I'll talk about it next. Here it is. The atrioventricular is going to take that impulse, kind of a wild, crazy impulse, and slow it down a little bit so that the atria can finish contracting before the ventricles. Otherwise, we end up with something like tachycardia, which the blood's going all sorts of directions. I mentioned this. The Purkinje fibers are in the septum here, and this is where those electrical impulses are going to go down and around so that the ventricles get this nice, precise contraction. When we look at an ECG, we're going to see various waves that indicate contractions. A small P wave that created by the SA node, then the R is way up here, S node complex, and then finally the T, which is just a brief rise when the ventricles relax. Take a look at this on a monitor. You're going to see beats per minute. You're going to see the QRS complex, really high R in this patient. I think, yeah, okay. Blood vessels, we have the large arteries, which are going to deliver oxygenated blood away from the heart. And because they're under such pressure, they need various layers of smooth muscle, elastic tissue to withstand the massive pumping of the heart. Also a large lumen, which means opening. The blood pressure in the lumen is highest near the heart, and that's why we like to take blood pressure readings in the brachial artery. But sometimes in emergency situations, we find ourselves doing it at the wrist or the calf. But the blood pressure is going to drop as you move away from the heart. Arterioles, we don't hear a lot about these. These are where the artery branches into a smaller diameter. They have baroreceptor reflexes, and so they can exert short-term control over the blood pressure, which is pretty slick. I'll talk about that in a bit. Not as much muscular tissue around these because they do need to flex and expand the lumen or contract the lumen. We call that vasoconstriction when the lumen diameter decreases, and the body's trying to shunt blood from one area to another. Example is when you're cold. Your fingers feel numb because your body's shunting blood to the core, keeping the heart, the lungs, and the brain rich in blood and sacrificing the extremities. Substances such as nicotine and caffeine can also cause some local vasoconstriction. Vasodilation. Here we have the lumen increasing where we need some blood. So if there's an infection or irritation, you notice how the skin gets red, or if you're embarrassed, sometimes your face will turn red, or at least warm. And also vasodilation in the sexual organs. That's why if a person's worrying or scared, often nothing's going to happen much in bed that night. Okay. Capillaries, these are the tiny blood vessels. They're still carrying oxygenated blood. Single layer of endothelium. And that is a good thing because we want these, they look like spider webs really in a surgery, but we want them leaky because if we have an infection, we want to be able to dump that blood right into the tissues. There's capillary beds that are exchange sites between the blood and the interstitial fluids. Okay, so we're not like a kitchen plumbing, right? We have gaps in our plumbing in a sense, and that's a good thing. Precapillary sphincters are going to regulate the blood flow, and I'll explain that shortly. Yeah, here's an example. When let's say you are exercising, well, the sphincters are going to allow blood flow to your muscles, but then the GI, which is gastrointestinal, your stomach, your colon, those sphincters are going to shut down blood flow to the gut. So we don't do a lot of digesting of food while we're exercising. Venules, you don't hear much about venules. This is where the blood is picked up from the capillary beds and it's deoxygenated. It's not blue, of course. We use blue to indicate deoxygenated blood, but the blood is just darker in color. Venules, you think of if you ever had a hemorrhoid, that tends to be a venule. Now the venules are going to dump into larger vessels, we call those veins, and they're going to bulge under pressure. And you know, much of our blood in our body is stored in veins, and we have massive valves to prevent that blood flow backwards. So how does blood get from our big toe back to the heart? Well, smooth muscles of the vein will contract, and they increase some of the venous pressure, but they can't do it alone. They need help. And here's where the help comes from. Contraction of the skeletal muscles. So by moving, and this is why we need to move really until we die. because it will keep the blood, deoxygenated blood, flowing back to the heart where we need it, and we pick up more oxygen. This is a problem with older patients. Okay. That is the end of the story. Hope you enjoyed it.